Are you holding up there, Vice President?
Did you have fun again?
Yeah, it was okay. Good afternoon. I'm going to call to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon. I'm chair of the committee, and today I'm joined by council members Andrew Johnson, who's vice chair of the committee, Jacob Fry, Elizabeth Glidden, and Alondra Cano. Lisa Bender won't be joining us today, but we're a quorum of the committee, and so we can conduct our business. The first two items are on our agenda are public hearings, and these are public hearings that were noticed. I will just let folks know that my intention is to continue these to July 7th. One, because we haven't completed our work considering the appointments and coming forward with recommendations on the first item, which is the appointments to the Neighborhood and Community Engagement Commission. And the second, because Councilmember Bender is not here, and this is her ordinance having to do with the keeping of honeybees, her ordinance amendment. So we're going to continue these to July 7th. But because they were noticed, I'm going to make sure that if people still want to speak, especially if they've come today to speak on these issues and will not be able to come back on the 7th and still want their voices heard, they'll have the opportunity to speak. So I'm going to open the first one, which is the public hearing on the Neighborhood and Community Engagement Commission appointments. And I'll ask the clerk, did anybody sign in to speak on this? Seeing no one coming forward, then I will move to continue that public hearing to July 7th, 2014. All those in favor, or if there's any discussion, I don't see any. All those in favor of the motion to continue this till July 7th, say aye.
Aye.
Any opposed? Any abstention? That motion carries. Then the second public hearing that we're also not really going to have today, but is in our agenda, has to do with the keeping of honeybees. So I will open that public hearing since we noticed it. Oh, I do hear someone who's got something to say. We'll take that comment into the official record. And I'm assuming nobody signed up for this either. Okay. Then I will move to continue this public hearing to July 7th. All those in favor say aye. Aye. Any opposed? Seeing none, that motion carries as well. Then next we have our consent agenda. There are 6 items on the consent agenda. I'll read through those, and if anyone on the committee wants to take one off for comment or discussion, feel free to do so. Item number 3, which is our first consent agenda item, is to authorize a contract for up to 5 years with the Bridge Healthcare Partners to provide revenue cycle management, billing, and consultation and training services to the school-based clinics for a total contract amount not to exceed $625,000. The second consent item, it has to do with the Preconception Health Services Grant, and this would authorize execution of an agreement with the state of Minnesota to accept a 2-year grant of up to $128,622 for the Preconception Health in Minnesota program and increase the appropriation and revenue estimate by that same amount. Both of those items will also be referred to the Ways and Means Committee. The third consent item is to approve the Southside United Neighborhood Priority Plan for the Bancroft Neighborhood Association, Bryant Neighborhood Organization, Central Area Neighborhood Development Organization, Corcoran Neighborhood Organization, Longfellow Community Council, Powderhorn Park Neighborhood Association, and the Standish Erickson Neighborhood Association, and authorize the proper city officers to execute any contracts or agreements necessary to implement the request. There are no funds associated with that. And the fourth consent item is to set a public hearing for August 4th to consider the subject matter of an amendment amending Title 10, Chapter 194 of the Minneapolis Code of Ordinances relating to food code, eggs specifically, and repealing the Chapter 194. Would anyone like to discuss any of those items? Councilmember Glidden.
Thanks, Councilmember Gordon. I really had what probably amounts to just a small process question on the Sun Neighborhood Priority Plan. So I'm not sure if anyone is here who can just briefly answer that. So maybe I'll just put out the question. It doesn't require that we hold approval of it, but one of the items that is, it's a pretty concise priority plan, but one of the items is very focused on interactions and requests to the Minneapolis Park Board. And I was curious if these priority plans automatically are forwarded to the Minneapolis Park Board.
Why don't we let Mr. Thompson?
So that they get them like we do, or
Did you hear the question?
I think I did.
Okay.
Since he prepared the staff report, welcome.
Thank you. Sorry, sounds like you moved me up. It sounds like your question is about how these get forwarded. And when we get a neighborhood priority plan from a neighborhood organization, what we do is send those off to the appropriate jurisdictions, either if they've requested to see it, or if they're somehow implicated in the neighborhood plan, we send it off to get their feedback. And then when we get that feedback, we provide that back to the neighborhood organization so that they can use it. So for example, it might be something as simple as a contact information at that particular jurisdiction, or it might be things that they should be aware of. Are there any plans coming up or issues that they may run into? So we look to get feedback early on from the neighborhood organization or from the departments on the neighborhood plans.
okay. And so then the follow-up, just does that happen then, I assuming, with this Sun Plan, which has a big component that is about request to the Minneapolis Park Board as opposed to the city of Minneapolis?
Yeah, we've had some discussions with the park board. We're still pretty early on. Part of that was a few things. One was, forwarding it to the park board, letting them know what's going on with this. The neighborhoods themselves right now are, I think, focused on the other two priorities in that. Particularly, I think right now they're concerned about particularly the multifamily housing piece and the reg services piece. And so I think they're kind of starting there, but the park board has some plans. My understanding is for later on this fall around some community engagement. And that might be a good time to really interact with them on that.
All right.
Thank you very much for the question. Also, knowing these neighborhood organizations as well as I do, I'm sure they'll be communicating this priority plan with their park board representatives as well.
Absolutely. Yep.
Well, thank you very much for coming just at the nick of time.
Thank you all.
So seeing no further discussion, then I'm going to go ahead and move items 3 through 6, all of our consent items. All those in favor, please say aye.
Aye.
Any opposed? Those motions carry. Now we are prepared to move into our discussion items. We have 4 discussion items on our agenda, and the first one has to do with the One Minneapolis Fund. And I believe we're going to get a report on this first. Hopefully, Mr. Howard.
Mr. Chair and committee members, I'm going to keep my remarks fairly brief. My role is to introduce the Neighborhood Community Engagement Commission members who did all the heavy lifting on the One Minneapolis Fund. But very briefly, this is the second year of the program. This year there's $80,000 available for small grants to groups that work with cultural communities on community engagement programs and leadership development projects. Again, it's the second year of the program. In the first year, 2013, we funded 3 projects, which are all well underway. In fact, they're wrapping up as we speak. So again, the NCEC has a committee that has spent a lot of time developing the RFP for the program, developing the criteria that they use to evaluate all the applications, and they did receive 24 applications. And they spent a lot of time reviewing those applications, reading each and every of the 24 applications, scoring them, and then determining what the recommendations were. So I just want to thank the members of the NCEC. They spent, again, a lot of time, a lot of meetings over cold winter nights to come to you today with these recommendations. So with that, I'll introduce Tessa Weejan, who is the chair of the One Minneapolis Fund Committee.
Thank you. Thank you, City
Well,
Council
welcome.
members.
Thanks so much
Thank
for
you.
being here.
Apologize for a little shout outs here.
Oh, don't worry about it. We enjoy it, and it makes our life better.
Thank you. Thank you for having me. Yes, we wanted to just sort of do a little background on what the One Minneapolis Fund is and make sure you understand our process, which was fairly engaged. And then we do have another couple of members of our committee here who might say a few words as well. So As Mr. Blinn said, this is our second year of the program. We had slightly more money, and we did make a couple of different changes to our priorities, including lowering the overall fund. Last year, we funded some projects up to $25,000, and this year it was $15,000. We did that in part because we were interested in funding more organizations, even if it had to be slightly less per organization. So this year we had 7 on our funding instead of 3 on the final that we passed. We also this year chose to do a fairly elaborate tool for how we would decide this. Last year was our first time as a committee making the decision, and so we had some priorities picked out, but we didn't have kind of a great rubric for it. And so this year, one of our committee members was able to bring in a different type of tool. And so what we did was, as you know, we wrote the RFP as a group. We had that go through the process of being approved by both the council and by the NCEC as a whole. And then we took that RFP and pulled out what we felt were all of the values. So things such as a diverse leadership group, reaching different people, having effect of getting people onto the city commissions or boards or involved in their local neighborhood groups, things like that. And so we detailed, I think we had 12 factors that became the decision-making factors, and then we weighted those. So some of those had higher and some had less. And so as a committee, we spent 2 to 3 meetings discussing the RFP, another 2 to 3 meetings discussing how to pull those values out and where to put and what to place them and how to prioritize them, and making sure that we, of course, didn't include anything that wasn't included in the RFP originally. We didn't want to bring out a new value to judge the proposals on that we didn't tell people we were going to use. And so that's how we got to that. So then each committee member we have 8 committee members, and everybody got the full. We had 24 proposals. 2 of them were from outside of Minneapolis, and we chose to have that be one of our restrictions this year, and so we didn't grade those 2. But the other 22 we all graded, came together and had 2 lengthy meetings to decide where we fell on that. And so as you know, we are proposing to fully fund 4 of the requests and to partially fund 3 of them. And so that's the proposal that you have in front of you. I think what we said last year is the same as what we would say this year is we had a lot of very good projects, and we would certainly love to fund more of them. So the more funding that we have access to, we think it's a really exciting thing. We are in the process of gathering the evaluation and report information from the first year. We've approved a report form and an evaluation process that will go out to those 3 groups that are currently doing it. The groups that are starting for the next round will get that at the beginning so that they have a little head start on knowing what it will be. But using that information, we hope to have a full report to you by September about the first round. The first round of funding, the contracts didn't get out until about this time last year, and so people are still in that year of finishing their project, which is why we don't have it yet. And so kind of what's coming up for you is a full evaluation and report of what happened in the first year, and then that's what's coming up for you. And then the results already seen. We wanted to mention that we have already seen some pretty exciting things come out of it. We have 2 actual members of the NCEC that came out of 2 of the groups that were funded, or out of relationship with those groups. So we already saw people joining our commission. We certainly have seen more, the people that have been participated in those 3 programs that were funded in the first round, we've seen more of them engaging in different processes throughout the city. And so that's been exciting. That's anecdotal at this point because, like I said, our report is not complete. So we have our council members, or committee members up here, and so they can answer questions about, our committee members here, and Andres can answer questions about the tool, which he was very closely helped lead us through. And then I just wanted to say, our committee fully passed this slate of proposals and then sent it to the NCEC Commission as a whole, and then the NCEC Commission as a whole unanimously approved this slate. And so we did have a lot of discussion over where these projects fell. We did look to what groups they were targeting and where in the city they were targeting to make sure that we weren't, overemphasizing one neighborhood or one group of people. And so we felt it was a very widespread, when we put them all together, that we were hitting all over the city, and we were happy about that. And so I'm just going to let Commissioner Israel say a little something.
Sure.
Welcome.
Good afternoon, council members. Councilmember Gordon. I just wanted to come
introduce yourself and your position so
sorry.
we all know.
My name is, I feel like I know you all. My name is Ishmael Israel. I am the chair of the Neighborhood Community Engagement Commission. I'm also a committee member of the One Minneapolis Fund Task Force. So I had the pleasure of looking and evaluating the 22 proposals that Commissioner Weegan spoke of. what I wanted to emphasize during my short time was the fact that this is round 2 for us. And in the first round, part of our process was reevaluating. We did a look back at what we could have done better and what we should have done, and tried to embed that into this round's RFP. So our factors were, we wanted to make sure there was geographic equity, there was ethnic equity, age equity, a broad range of engagement methods, and what you see in front of you, the slate before you, represents just that. We could not be more honored for this commission to have Commissioner Andres Orloso. He has developed this awesome tool. I have no other word to say, but it's just an awesome tool. It partially removes the knee-jerk reaction of reviewing proposals. They were most of them were great proposals, but in the end, we wrote a RFP that said that we had a criteria, and we weighted that criteria, and Commissioner Orloso put together a scoring engine that we all individually scored each of the 22 proposals, and we landed on this slate. There was some robust conversation after that between the committee members, and it was, couldn't be more proud than my fellow commission members, and I think that the work was well received by the full commission. It passed unanimously with no dissent. So with that, I want to introduce Commissioner Orloso to tell you just a little bit about this tool that he's developed that I'm hoping that we can use in more of the processes as the work that I do here in Minneapolis. Thank you.
Thank you very much.
Council members, thank you for having us. Again, my name is Andres Orloso, and I came to this committee, and I was just a member at the beginning, and knowing that my background was in process improvement, they kind of like tasked me to come up with this tool. I wish I could actually take credit for inventing the tool, but I could not. This tool was invented by a British mathematician. So this tool is actually used by a lot of Fortune 100 companies and NASA, and I have used it a lot while I was in the military. And it's actually my desire to eventually maybe present it to the full council, because it's a tool that the council might be able to use in making decisions less influenced by emotions and assumptions. And that's what we did. This committee, I have to commend the chair. She did a lot of work, as well as the chair of the full commission. And we debated over this 12 decision factors. So for this year, we decided these are the important ones. So next year, it could be that we would introduce new factors. And then we went ahead and, as Commissioner Israel said, we debated even the weighting. And then once the tool was completed, we gave them a little how to use tutorial. And then each commissioner have the copies of the proposals. They only saw their own scores as they're scoring. And as the confidence of the tool, it proved that it's a valid tool, because all 8 commissioners came up with the same top 10 using the tool. And then the discussion came later as to how to allocate the funding to the top 10. And if you have any questions, now I can feel how it feels, because he comes to our meeting and I give him a hard time. So it's your turn to give me a hard time. Thank you.
Thank you, Commissioner Hollis. So I wanted to just go ahead and go through our list, and we certainly would love to answer questions at any time. But we did want to stress that although we did use this very mathematical structured tool, we also had very robust discussions. It was important to the commission members that we don't turn in our scores and that's it. So we did come to the table, discuss what was scored, discuss what we liked or didn't like about the proposal, and that was how we did end up with some partial funding. So the funding that we are proposing, that was approved by both our committee and by the NCEC as a whole unanimously, is to fund the Lake Street Council at $15,000, Appetite for Change at $15,000, Asian Media Access at $15,000, Council on American Islamic Relations at $10,000. Then we have 3 organizations that we recommended partial funding for, which are Youth Care at $10,000, Twin Cities Media Alliance at $10,000, and Organizational Apprenticeship Project, or OAP, at $5,000. So that is our recommendation for this year. As we've said, we're happy to receive additional funding and next year be able to fund even more projects, because we certainly did receive, and this year and last year, it was impressive to me how different, we received some great projects the first round that we didn't see this year, and so overall we've just seen a lot of interesting and good ideas out there. But certainly, if it's appropriate, are open to questions at this time.
Definitely. First, I do want to thank you and everyone involved so much for all the work and all the time and all the effort. Appreciate how seriously you took this, and I think having some kind of tool and metrics is really helpful. It can be helpful later if people are wondering how did you make those decisions and how did you get there. I think that committee members might have some questions. I'm not sure. I know people were very interested in this, and when I saw this, I think one of the things that might just be helpful before we see as other people are making some decisions, in the report you talk about those that were partially funded, but you don't offer much of an explanation about why they weren't funded. Is it just because the funds weren't available? And then seeing the OAP come in at 5,000 when everybody else is 10 or 15, was there a rationale behind
Great.
that?
Why don't I discuss that first and then the other two? So the OAP was funded at $5,000. It was, I think, close to a $15,000 proposal. However, when we looked at it, there were 2 factors that came out. It scored very strongly because of the program aspect of it. But if you look specifically at their proposal, they were planning to do a large conference and then supportive programming throughout the year. So we really loved the supportive programming throughout the year. It was exactly the kind of thing we were looking for. What we were concerned about is so much of their budget spent on a big event. And that was something that came up the first round of funding as well, is that we didn't feel like event programming, one big thing for 1 year, was the real way to engage and intrigue, get people in and hold them in, or get them in for the long term. And we also, first factor being we're not comfortable with funding large events, so that we didn't say that very, very well in our RFP, but we did talk about ongoing programs as opposed to a one-shot thing. Secondly, we actually, a number of people on the committee remarked that we actually have a conference. So the NCR, the Neighborhood Community Relations Department, does a large City Connections conference, which would be a perfect venue for this type of work. And so when we took out the conference part of their budget, this is what we were left with. So they did score very highly. But when we looked at what projects they were going to do, we were very concerned with not wanting to duplicate the kind of city conference we were already doing, and also not funding one-off events. So that was why theirs dropped. And so then after we had OAP and the top 4 in, we ended up with 20,000 left and 2 groups left. So and the 2 groups were pretty close in their scoring and how we felt about their projects. And so instead of giving one 15 and one 5, when they were both pretty similar to how we felt about them as projects, that's why we split it with 10-10. And all 3 of the groups that had received less than full funding were approached by staff and asked if they would accept the full funding, and they were all said absolutely. So we feel pretty strongly that this is a good slate of how we're doing it. If they would accept the partial funding, and they said yes.
Okay, thank you. I do see some other questions. Councilmember Johnson.
Thank you much, Mr. Chair. I just had I wanted to clarify on that specifically.
Sure.
With OAP. I was looking at their budget, and it looks like 5,150 is for that proposed conference expense, which would be half of the 10,000 that they didn't receive that they were looking for.
Or a third of their overall budget.
Yeah, a third. So why not the other 5,000? Also, I see a lot of other applications that do have events and big meetings and festivities and such in their budgets.
So if I can clarify, it wasn't that we weren't going to do any events whatsoever. It was that we didn't want it to be focused on one large event and everything stemming out of that, and the fact that the city already does that. NCR department does a City Connections conference that's very similar to exactly what they were describing. And we felt in discussion about how to best utilize our resources, we felt we could ask them to do that work as a part of the conference and therefore not need any of that funding. And then if you look at how that breaks down and why I'm saying we funded enough to fund the rest of it, some of those overhead costs and the administration costs and those percentages go down if you take out that initial conference price.
Okay, Councilmember Glidden.
Well, thanks, Mr. Chair, and I think what I'm going to do just to kind of get the conversation going here is I'm going to go ahead and move approval of this item per the staff recommendation. I think we've had a lot of presentation on this item, which is about a small grant program that amounts to $80,000. And really, it seems like there was a very robust process. I know from serving on nonprofit boards myself, which is maybe a little bit similar to the process you have with the commissioners, that when you take time for these meetings, it sounds like you had how many meetings for awarding $80,000 of grants?
Yeah, a lot, like 8 to 9 for just this year of the process.
8 to 9 meetings for awarding $80,000 of grants. I know that you have done work to redesign from year 1 to year 2. I would imagine there's probably work that's going to be done to redesign from year 2 to the future as well. You designed a criteria grid, which is similar, I will say. It may not be the exact same type of grid, but similar to other processes that are used also by city staff. I know in other grant programs that we've seen awards, such as our Great Streets programs, things that are done by the health department, which frequently awards sub-grants out of funding that they receive. So I feel comfortable you had a process. I think, too, when there's a process and there's a group of people that participate in the process, it becomes hard to kind of pick apart that process and say what might be different. And so, again, I may have an opinion that's just different from some of my colleagues, and I value, that they have other thoughts they may want to share on this, too. But I feel comfortable that you had a process. You shared with us this process. It seems to me like a pretty robust process for this amount of money, which will be very important to the organizations that are receiving the funding, and for them to also feel confident that you did have a process and rationale, whether they agree with it or they don't, for how the funding was awarded. And I want to say thank you. You did a lot of work. I respect your work. I'm not going to come in and second guess you. I think that if there's things for the future, maybe that's for the comments or for engagement going on into the future. So on my behalf, at least, thank you for the work. I know it takes a lot of work to make these decisions, and they're often not easy. They're hard, and I know you would have liked to fund more organizations if you did have the funding.
Councilmember Cano?
Just a point of clarification. So do we have a motion to approve?
Yes, we do. That's
Okay,
been
good.
moved.
And then can I second it?
We don't need a second in committee, but you
Okay.
can go ahead and speak in favor of it.
Wonderful, thank you. So thank you so much for the commissioners for being here today. I do appreciate all the volunteer work that you put into helping this process move forward. And I just wanted to say from my perspective, the One Minneapolis funds have been a discussion at the table, at various tables, and we want to see more funding go to this particular pool of funds, because I have personally seen the positive impact of that work through the White House and the 10 new Latino community members that have now been placed in the boards of neighborhood associations. And so we want to continue to see that kind of work happen and develop, and I would be happy to work with you to fine-tune the program, to grow the program, and to help figure out how to articulate its outcomes and continue to get people engaged in this process. So thanks for being here today.
Appreciate that. Councilmember Johnson?
Thank you, Mr. Chair. And I appreciate the work of the committee and your involvement and your analyses and processes on all of this. I know I'm interested in working with both any commissioners and staff. I do have some outstanding questions just on this. I know that obviously it's a very important topic, this One Minneapolis goal we're working towards. And really the key of this was both in the RFP, the community engagement piece, and the developing diverse leadership piece. And those are two things that are very, very important to me. And there were some questions I had in there. For instance, I know one of the proposals specifically wanted to, and it received full recommendation for full funding. They wanted to hire a consultant at $100 an hour for 70 hours to create economic impact studies. And that would be, for instance, one of those things. How does that hiring of a consultant to create a study, how is that going to further development of diverse leadership? Are people being engaged with that study? Are they because specifically looking at that particular proposal,
Talking about I'm sorry, excuse me,
yeah,
Councilmember Johnson. Can you say, are you talking about Asian media access or which?
yes, and
Which proposal?
that's the Asian media access, just for
one?
instance.
Okay.
So, and I have questions for many of these applications,
Okay.
but with that, I understand. So they want to spend, outside of that question of the consultant to create economic impact studies, they also want to spend $6,000 on soliciting economic ideas. And I understand from their specific application that when it comes to soliciting those economic ideas, that piece, they will be going out and engaging community members and asking them for their ideas. So that is where the community engagement piece comes in. With the specific economic impact study, where does that come in? Because I didn't see anything about that in the application. And also, how does that mix with the work that is being done by city staff and other agencies? How does that assist and not duplicate? I think these are really important questions, and I am very interested in these because, granted, $80,000 for a $1.3 billion organization such as the city is, it's a drop in the bucket. And I know that I've heard it, I've been told it, that, you know, that's a very small amount. But I also know, working with neighborhood associations, just how important this money is. And I know that you know that as well. And that is a huge, huge concern. So that we want to make sure it goes the furthest. And then I do have one other question too.
Can I
which
answer
is,
that question
yes,
first, though?
absolutely.
Okay, sorry. I wanted to answer them before I get lost on which
Certainly.
question we're on. Thank you. So Councilmember Johnson, I believe that one of the criterion for our process was to have things that were innovative or a different type of engagement process. And so we were looking for proposals that came up with new type of ideas that we hadn't seen these type of groups doing or these groups doing in this community. And so as to the rate of the consultant, that's actually a low rate for some people for doing this type of work. What they are going to do then is use the studies that they've developed in conjunction with the community engagement work so that their community engagement work is driven towards solutions. So instead of just going out and talking to people and getting ideas, then everybody's been talked to, but nothing happens, they're developing a process using a consultant to look at what are we going to do with these ideas and how are they going to relate to the economic impact, and then how do we do leadership and developmental change out of that? And so that's kind of how those processes fit together. So they're not separate processes. And I think it's important when you do community engagement that you have a reason, because there's an expectation gap where if you ask people their ideas and you don't care or you're not going to do anything with it, they know, and eventually they stop telling anybody their ideas. And so that's why it's important for that group to have that baseline before they go out and talk to people so that they're using it in a wise way. And that consultant fee, yeah, it's high, but these groups, we're not giving them enough money to hire staff. If you hire staff, low entry-level staff with benefits are not that much, but if you hire a person who knows what they're doing, it's getting close to that if you hired them at a rate with benefits. And now, I'm sorry, I'm happy to hear your next question.
And I hope that when these groups are going about their work too, they consider how that interfaces with other work being done, because I know, reading through one of the applications, for instance, they essentially said that they'll be developing small area plans. And I know that our CPED department, Community Planning and Economic Development, they work with neighborhood associations and develop small area plans. So is that an effort that is duplicative? Is that an effort that is symbiotic and is working with our CPED staff? Because I know that wasn't mentioned in there. And I want these organizations to be cognizant, and that's even just feedback that can be relayed back, because I think we want, as leadership, and as you are leaders as well within the community, you want, right, these dollars to go as far as possible. And so I think that's one piece. And then
I can answer that one then. So for Councilmember Johnson, yes, so what we have done in the past with our funding is each group, we looked through their proposal throughout the year, we met with the leadership throughout the year, and then hooked them up with the places in the city or the places in other organizations that we felt were symbiotic and would work together. So for example, if the Conflict Resolution Counseling Center was one of our first year funders, I'm not getting their name right, but they came in and told us the work they were doing, and so we connected them with 3 or 4 other organizations that committee members knew of, that staff knew of, that was doing symbiotic work, so that would be streamlined. So that's exactly what we plan to do. And that's how although it is funding similarly to a foundation or a nonprofit, it's not we're not giving the gift and leaving. We do ongoing support at the committee level and at the staff level, so that we do make sure that it's combined. And that's something that we'll also be reviewing with our reports in our first year evaluation.
Excellent, thank you. And then just on that one, I was just curious, were groups excluded who currently have funding under last year's amount?
So we had a big debate over that, Councilmember Johnson, because we weren't, with the low amount of funding, we didn't want to spend it on the first year groups necessarily, even though we had some amazing projects. However, some groups like the White House that was mentioned is a part of a really large organization, and we felt like if we said this group can't do it, then that would exclude all of their other, they're part of Pillsbury White House, or Pillsbury United Communities, and we didn't want to exclude the entire Pillsbury United Communities because one location got it. And so the choice we made was to say that this year of funding, and this is written in the RFP, we would accept proposals from the same organization but not for the same project. So the White House could not receive the same funding for the same project, but Pillsbury could apply for another grant in a different location. And that is something we had a lot of debate over, and I think if we received additional funding in the third year, we'd be happy to refund people, because we saw some amazing work the first year that we weren't happy to not be able to refund them, but we also wanted to diversify and make sure that other people were getting funding.
Great, thank you.
So there is a motion on the table here, and I apologize that maybe our discussion kind of went back to answering questions and having some more interactions. But what I'd like to see is if there's any more comments on the motion, and maybe we'll let you sit down and relax now. And thank you very much for your presentation and answering the questions. And if something else comes up, we know you're here. We actually had a lot of discussion, and I just want to commend Councilmember Johnson for taking all the time to go through so many of the applications and do so much of the research. And I was sympathetic to the idea that there might be some lingering questions, so I was willing to hold this over in committee. But I also understand the recommendations and all the work that went into that, and appreciate that Councilmember Glidden has made the motion. And I'll support that motion. And as a fallback, I know we can hold this in committee and we could work on it for a couple weeks if we wanted to get more answers, more questions. But I have a sense that the motion is going to prevail. So seeing no further discussion then, assuming that Councilmember Cano is done, thank you. I will then call for the aye votes in favor of the motion to approve the recommendation coming from the commission. All those in favor say aye. Aye. Any opposed? That motion carries. And I think, is there any other staff direction or discussion on that? Councilmember Johnson.
Thank you, Mr. Chair. So I do have a staff directive that I've drafted up here. I just want to pass this out to my colleagues. And now this is specifically sort of in relationship to the work we're doing on open data policy. And it just came into play with this specifically about having to go to staff and ask and getting hard copies made because electronic copies weren't available of applications. And so this staff directive addresses the non-data piece. And this is really something I'd like to see all departments across all committees doing, but we'll start in our own house here. And the staff directive reads, in the interest of transparency and public access to public information, all departments who report to the Health, Environment, and Community Engagement Committee should provide electronic copies of grant applications to the clerk's office so that they can be linked to the public meeting agenda. Staff should provide machine-readable electronic copies rather than scanned images of documents whenever possible so that the text of documents is searchable. Staff should follow existing processes and statutes for handling of confidential and/or private data. So, Mr. Chair, I would move that we adopt this staff directive.
Okay, so that motion is before us. I just have one question. Did you review this with the city clerk, and does this seem feasible?
I certainly did, and the city clerk thinks it's a thumbs up on this idea. So, yes, we can do that.
Okay. Madam Clerk, is this something that you're aware of?
I know it's something that Casey Carl had worked with Councilmember Andrew Johnson on.
Okay. When you see this, do you think, oh, another 20 hours of work for every committee, or you think, okay, I appreciate that then, because we don't want to overwork you. I don't see any other comments on this. Councilmember Glidden.
Right. So we do have an existing directive that Councilmember Johnson has kind of taken over, helping to usher through, which is our city staff are working on kind of an open data directive. And so this, I think, is somewhat aligned with that, although it's more about what is the public information on the agenda. And I guess probably the only caveat to this, you already have here that it's the non-public data, which is one of the legal requirements, so it's probably just more an issue of functionality, I would guess. I don't know if there are any other public data issues. I don't know if any staff desires to respond or if you knew about that, but this just seems like another march in that step of public accessibility. So,
Right.
Mr. Belinda, did you want to comment?
Certainly. We'll certainly look at the data practices aspects of this. Also, we'll work with procurement because we work with procurement to receive the proposals. And currently, we don't accept electronic submittals. So perhaps that's another piece of this puzzle that we'll have to work on. Thank you.
So I just want to note, I appreciate that there's not a date certain here. It's more as we're able to work through the process, and this seems like one where the intent seems one that is achievable, but may need to have some pieces worked through with some of the other offices like procurement and others. So that seems workable. Yeah.
Okay, thank you very much. Councilmember Cano?
I think this is the spirit of this initiative is in line with a lot of the work we're trying to do as a city. I feel like I need more time to figure out what the implications of this staff directive would be in terms of cost and time from the staff members to implement this, but also how are we implementing this across the entire organization, because there's other committees that have really important work happening that would also benefit by having this public access node available. And I just got out of the racial equity work group that we had at the mayor's office, and there's also a big demand to kind of express that information and share that information online and in our communications department. So I just need to understand more about the prioritization level of each one of these initiatives, how they speak to one another, what's the implications of budgeting and cost on these kinds of things. So I feel like it's a good starting point. I don't know that I can support it right away because I need more information to figure out how to move forward.
Councilmember Johnson.
Thank you, Mr. Chair, and I appreciate Councilmember Glidden's notes on this. This very much is aligned, but not overlapping with the open data policies that we're working on, which is really around data sets. And this is, coming from an IT background, certainly not 100% experienced with the systems that the clerk's office uses to publish agendas and stuff, but putting out documents like this, which we already do for a lot of presentations and other things like that, is easy. It's a simple step that we can take, and granted, it sounds like we might need to make some process tweaks over time to procurement so that we get this out there, but this is the general arc of what the public is interested in terms of having availability to that information, and frankly, even for council members when there are these grants, when there are documents, so that we don't have to keep going back to staff and asking, well, what's this? Can I see this? Oh, you got to run it down to my office. But instead, it's out there for everyone. And also for our NCEC commissioners and for these organizations out there doing the work, this is just yet another opportunity to elevate their ideas, elevate the work that's going on within the community, to share that, because there are a lot of different things that these groups are doing. And frankly, it is pretty fun to read about all the different initiatives that these different programs and groups are working on, and to think about the diversity of their impact across many different things, from access to food and healthy eating initiatives to conflict resolution. It's just very, very broad. So I think that this is a very minimal but positive thing that we could do that would benefit our constituents and make our city all the better. Thank you.
Thank you, Councilmember Fry.
Thank you, Chair Gordon. I just have two questions. So I understand that these submissions are presently not made electronically. I believe you said that?
Mr.
That's
Blair.
correct, yes.
And so they're made in hard copy and signed with a pen. And
They are.
how hard would it be to change the system up so that you have the submissions are made electronically?
From a technical standpoint, I don't think it'd be hard at all.
Okay.
The question that we have to answer is, are these grant applications public information? Are they available to everyone? And I don't know the answer to that. We'll have to work with the attorney's office and the clerk's office to determine where that line is drawn.
But assuming that it is public information, this wouldn't be a drastic change in your policy?
I don't believe so, no.
Okay. That was my first question. Then my second question may be directed to Councilmember Johnson. I'm not really sure. So it says staff should provide machine-readable electronic copies rather than scanned images of documents. I just don't know what the difference is between those two.
Mr. Chair, I'd be happy to answer that for Councilmember Frye.
Okay, thank you.
So basically what that is and what that means, and it does say whenever possible, is that if, for instance, there's an application that's submitted that they do not have an electronic copy of that application, it was something that somebody sent in from an organization, that right now that would be presented in a scanned document, like a PDF, for instance, and that would be scanned. The difficulty there is that if you open up the PDF and you do a Control F, you're trying to find something in it, you can't search it because they're images, they're scanned images. So when possible, when our systems allow it, when we do get applications in electronic format, like a Word document, for instance, where we are able to search through it, that is the copy that we should put out there. Because one of the big issues with that is that it also then gets picked up by Google and other search engines. They're able to index those specific documents. So when you do search for something like Conflict Resolution Center or Organizing Apprenticeship Project, that would show up in the search results on Google and externally, and it would say, oh, here's a PDF or a Word document that had Organizing Apprenticeship Project in it, and it's a grant application. So it just makes it easier to find things. Thank you.
Okay.
I'm all good. Thanks.
Satisfactory? All right. Seeing no further discussion then on the staff direction from Councilmember Andrew Johnson, all those in favor say aye. 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 All those opposed? All those abstaining? Okay, that motion carries with one abstention. Then we can move on to our next item on the agenda. Thank you very much, everybody, for your discussion and participation in that. Commissioners, for all your hard work. The next discussion item is neighborhood priority plans, and this is a summary and a brief report and presentation with the intention to receive and file this. And Mr. Robert Thompson will share what you've learned by looking at all the priority plans.
Yeah, Chair Gordon, council members, thank you. Your last meeting, I heard that, and for the audience, I'm Robert Thompson, Neighborhood and Community Relations Department. And at the last meeting, I think there were some questions about, how many plans have been submitted and what the status is of those. And so I wanted to kind of hopefully quickly run through this for you, let you know where we're at. But so far, just a quick summary, we've had 29 neighborhoods so far that have submitted 47 priorities. Through these neighborhood priority plans, where they're identifying, the issues basically that are important to them. And just a quick contrast, you may recall under the in the old NRP days, neighborhoods would spend 1, 2, 3 years planning to come in with these long 10-year plans that were very dense documents, 30, 40 pages long, with 10, 20, 30 strategies in them. And what we wanted to do was to simplify the plans, make it easier for neighborhoods to work with. And they can come in earlier in the process with items that they're still formulating rather than after they've determined an outcome or a specific outcome that they want before talking with city departments. So we're asking neighborhoods, come in with these, don't spend as much time planning, come in with them more at the priority level, which is why we call them priority plans rather than the strategy level. So we've had 3 neighborhoods so far in North Minneapolis with introducing 16 priorities, 5 in Northeast Minneapolis, introducing 12 priorities, 9 in South Minneapolis with 5 priorities. That includes the Sun neighborhoods, the 7 neighborhoods that are 7 neighborhoods collaborating together, and 12 in Southwest Minneapolis with a total of 14 priorities. And I should point out, it's not just one neighborhood, one priority. Neighborhoods will come in with sometimes 3, 4, or in one case a dozen priorities in one plan. And sometimes neighborhoods will collaborate together to bring forward 1, 2, or 3 priorities. And that's one of the other things that we wanted to accomplish was really focus more on partnership and collaboration between the neighborhood organizations and the departments. And I'll talk more about that in a second. Some of the topics, though, that we're seeing from the neighborhood organizations broadly are, for example, jobs and economic development. We're seeing community building initiatives from neighborhood organizations, which of course they've always worked on, but includes public spaces, neighborhood cleanups, neighborhood identity and signage, several initiatives on environment, simple community cleanups, getting out trash cans, things like that. Farmers markets and community gardens, which are very important to a lot of neighborhood organizations and their residents. 13 priorities that are focusing on housing issues and inspections. 11 that are focusing on parks. 3 on planning, for example, transit, of course, is a very important issue to a number of neighborhood organizations. 6 on safety, and 3 on youth initiatives. So they're across the board, and what this reflects, and I think is really important, is that neighborhood organizations are sometimes great multitaskers. They work on a lot of different initiatives at the same time. So they're working, a neighborhood might be working on safety, they might be working with MnDOT on a transit issue, they might be working on a housing initiative, and all of these things going on at the same time while they're also planning their community festival. So they have to do a lot of work, and most of this is driven by volunteers. They're working with a lot of different departments so far, and as I mentioned earlier, what we do when we get these neighborhood priority plans, the first thing we do as soon as we get them from a neighborhood is we forward them to the different jurisdictions or other agencies. So they go to CPED, they've gone to the Health Department, Hennepin County, the Police Department, Park Board, Public Works, and the Health Department. And our first goal is just to find out, is there something the neighborhood needs to know? Well, actually, even before that, just to give those departments a heads up. Here's what the neighborhood is thinking. But also to get feedback from those departments about, are there issues the neighborhood should be aware of? Are there processes they should be aware of? Are there staff they should be connecting with? Just as an example, one of the priorities that came forward was on neighborhood signage. And actually, we found out something interesting in this. There were actually several neighborhoods working on signage in South Minneapolis. And some of them were just going out and buying signs and bolting them up. And you may recall that, in the early days of NRP in the 1990s, a lot of neighborhoods, the identity was really important. They spent a lot of money on signs. They would go out and put them up. And then the signs have been wearing out, so they're just replacing them. Well, there's rules and processes, and so we kind of latched onto that and started letting neighborhoods know, there's actually a process and there's actually a person that's at the department you need to talk to, because otherwise, once you put up their signs, they'll follow you around, take down your signs, and charge you a fee for that. So let's do it the right way the first time around. So it's been helping us to kind of give neighborhoods a better process and better connections right up front before neighborhoods get really frustrated working on things and then finding out after the fact that, they've spent a lot of time working on something when they should have connected with the city department earlier on. So that's one of the things that we're really trying to accomplish with this. So that's sort of the broad overall picture on this. The challenge, I'm going to talk real quickly about some of the challenges we're facing with these neighborhood priority plans. Of course, we have 70 neighborhoods, which means the potential for a lot of priorities coming out of these. And each one of these really takes a very different route. It's not just a matter of our getting a plan from a neighborhood, running it by staff, and then, posting it online and just saying, that's done, we're finished with this. We really have to follow up pretty closely on a lot of these. A good example is the 54th and Lindale, where the neighborhood, the sort of the basic issue there is establishing a special service district, and this is something that neighborhoods have been interested there for a long time. And there were some barriers that the neighborhood saw. Public Works was working on it, but there wasn't good communication going back and forth. Fortunately, when we brought that, I happened to mention it to the council member who latched onto it, and fortunately John Divig in Councilmember Quincy's office really kind of took off with this thing, and he helped a lot, and also Jennifer Swanson at then Councilmember Hodges' office. And it was kind of interesting because I was chasing this thing all the time, trying to catch up to it. It really kind of took on a life of its own, but they worked really closely with Public Works on addressing that and getting the special service district going, which is really great. But there's this other layer of communication and the partnership and how they work together. That's sort of this other layer that we're still following up on. So there's several layers on some of these. It's not just a matter of getting this project going, but it's really establishing ongoing partnerships and relationships. And so with each of these, we really try and follow up to see where they're going. Some are fairly straightforward. They don't need a lot of follow-up. Some need a lot more care and attention as they're going. The Sun neighborhoods, for example, is an issue of that, example of that too. We're trying to keep in touch with the neighborhoods and follow what they're doing, but that's going to be a long-term, I think, fairly complex project. Where we're at now, though, with these neighborhood priority plans is we're still having neighborhoods produce them and bring them in. Some of them we approve. We have sort of authority at the department if they're already part of a Phase 2 plan, NRP Phase 2 plan. Some of them we bring to the NRP Policy Board for approval, and then they come to the City Council, like the Sun Neighborhood Priority Plan. What we really want to do, though, now is really start doing some analysis on, is there a better way of doing these plans, bringing them forward, and especially following up on them. How do we make sure we're really tracking these well? I would not be at all surprised to hear that there are things that are falling through the cracks on these, and I want to make sure that we're identifying those cracks. Doing some better reporting on these. We have a process for neighborhoods reporting on their community participation program funding, but I think it's going to be really important to figure out how to do good reporting on this, to have neighborhoods come back and say, here's how this neighborhood priority plan has been working so far. And then really taking that to outcomes, because again, each of these neighborhood priorities is very different in nature, what they're dealing with, and so kind of coming up with a sort of a simple process for analyzing outcomes, I think will be a bit of a challenge. So I think we're going to have to, again, identify unique outcomes for each of these neighborhood priority plans, and when we can check the box and say that's done. So that's probably what we're going to be really focusing on, I think, besides getting more of these plans in, is to really start thinking through how do we analyze these and make sure we're really following up and getting the work done. So, any questions?
Yes, I see a question. Councilmember Cano.
Thank you, Mr. Chair. I was a little curious about why there aren't any budgetary notes to this. Usually plans have a budget, and I don't know if this is part of the process and sort of freedom to let people think about what they want to do. And then also, whose shoulders does it fall on to see sort of the implementation? Is this more the neighborhood associations, or is it more the city, or is it a partnership?
Yes. Councilmember Cano, sort of some different answers to that, because some of these, let me get back to the budgetary one first. Some neighborhoods are, in fact, and I probably should have included that, and I will next time, but some of the neighborhoods are identifying what we're calling a set-aside or a reserve, a neighborhood priority plan reserve, or they're setting money aside that they can use for a neighborhood priority plan. And some of those we've contracted immediately, and so there's a contract attached to that will have a budget in it, depending on that particular project the neighborhood is working on right at that particular moment. Some of these plans are really just part of that neighborhood's overall funding. So they really aren't identified as a specific separate project. So for example, again, with the Sun neighborhoods, that's going to be sort of an ongoing just activity of those neighborhood organizations for quite a while, about working with the parks, working with the city, et cetera. So with those, they don't have a specific budget because they didn't allocate specific funds to that project, even though it's fairly complex. So let's see, okay. On the implementation, some of these are just implemented by the neighborhood themselves. So Fulton neighborhood working on farmers markets, that's something they're just doing on their own. They're just working with Kingfield Farmers Market to start a farmers market in their neighborhood, or particularly it's already started, but to promote it, market it so it gets better attendance. Hale-Page Diamond Lake wants to start some new farmers markets this year. They're just doing that in consultation. So for us, it's just, we know they're doing it, we're aware of it, we let health department know that this is, because that's, kind of where the home of these things are. So they're aware that those neighborhoods are working on it, so they can track those as well. Others, again, we have to be much more active as a department to help kind of move these things along. But other places, if it's like a housing initiative, that might be more appropriate for CPED. We're not experts in these kinds of things, so what we really do is we just kind of pass the baton along. Say, Victory neighborhood in North Minneapolis wanted to work on a business program for home businesses. And so we just connected them up with the appropriate staff person at the city, at CPED, and said, here's what you neighborhood need to develop to put into a contract to work with the department, and then we just step back and get out of the way. So.
Well, thank you very much. I also think it's very useful just to see all the priorities listed like this, and the neighborhoods that have done them. I think McKinley gets the award for the most priorities, but I think it's helpful for council members to see those in our area. But then also, I'm hoping it's helpful for other neighborhood organizations to see what are the priorities of others. So I appreciate you taking the time to kind of bring this together and share it with us and put it on the public record like this. And I agree that outcomes and how you measure those, what are the metrics, how do we know when they've accomplished their priority? That's tricky, and it's something each neighborhood might be looking at differently, or some maybe not thinking about much at all yet, but I think that'll be important for us to see too. So I really appreciate your willingness to come here and bring this forward today for us to look at. And I don't see any other questions or comments, so I'm going to move to receive and file. Thank you very much. Any comments on that motion? Seeing none, all those in favor say aye. Aye. Any opposed? Any abstentions? Well, that motion carries. And now we can move on to maternal and child health initiatives. We got to see a little bit of maternal and child health earlier in our committee, and so now we can hear it about from a more citywide perspective. Ms. Bowler, welcome.
Thank you. We wished her baby would have stuck around because it would have been a great prop. But we have some really nice photos embedded in our PowerPoint presentation of babies. So I'm Patty Bowler, Director of Policy and Community Programs for the Health Department, and we're going to give just a quick overview of our early family and early childhood work. We also call it maternal and child health. And with me today are some key members of our team and some community partners as well. And Angela Watts is our Healthy Start manager, and she's going to be joining me in the presentation. Angela? And also Brittany Roy, who is a Healthy Start participant, will be briefly speaking. Also here are Stephanie Graves and Ken Smith. They're both key members of our team. And we're really happy to have some Healthy Start partners with us today as well from the Family Partnership, and they're here waiting. They've been waiting very patiently through the discussion items. So thank you again for coming.
Appreciate the long wait. I'll also just note that the mayor has a Cradle to Cave cabinet, and this is some very important work that the city's engaging in kind of under the mayor's leadership, and so we thought it would be important for our committee to get to kind of see where are we with this now, and how can we look at this more as one kind of entity or subject matter and coordinate that better with the mayor's initiative. So that's one of the reasons we're hearing it. So
yes, thank you, Councilmember Gordon. Family and early childhood work is one of our department's largest focuses. We've got about 38 FTEs supporting family and early childhood activities, and this work includes Healthy Start, which is our infant mortality initiative. It includes all of the home visiting work. It includes safety net services, we have a contract for children's dental services, preventing lead poisoning, school-based clinic work, the prevention of teen pregnancy and sexually transmitted infections, and also increasing the involvement of fathers in the family. And it represents about a $9.29 million investment. The small chart on the upper right-hand corner of the slide represents how we spend family and early childhood funding, and it's divided into 4 categories: direct services, which is about 28%, contracts, 59%, administration, 11%, and in-kind support, 2%. And it should be noted that most of our funding comes from grants. We have a lot of federal dollars and also some state funding. The bigger pie chart indicates the chunk of funding that goes out in contracts, and this is mostly how we do our work. So just going back to a previous agenda item, I think we'd be very interested in being part of that discussion on how, on the whole electronic notification and replying by grants. And if you note, almost half of the funding on our pie chart funds home visiting efforts. The presentation, however, today is mostly going to focus on our infant mortality work, our home visiting, and early childhood efforts. We're going to touch very briefly on school-based clinics, but we're not going to talk about lead and healthy homes. But we hope that you're going to have future presentations to really delve more deeply into those topics. Yet, with all this investment, we have very critical issues in our city. Just to lay the groundwork, there are about 6,000 babies who are born to mothers in Minneapolis per year. A large chunk of our children, 32%, live in poverty. U.S. African American babies are twice as likely to die in the first year of life. There are a substantial number of homeless children in our community. And the Minnesota Department of Health relayed that adults have reported adverse childhood experiences like homelessness, parental neglect, substance abuse, severe dysfunction in the home, and other factors that have a strong impact on physical, social, and emotional development. And about 55% of adults reported one adverse childhood experience. We call these ACEs. And of the 55% reporting one ACE, 60% have at least two ACEs, and 15% reported having 5 or more ACEs. Understanding adverse childhood experiences and the factors that contribute to help might explain why some of our children aren't thriving. This slide, I think, is kind of a slide that underpins or grounds public health. It shows the very factors that determine health. And one reason that we still need to make improvements is that oftentimes our society has looked to medical care to solve some of these issues, and you can see these factors that determine health, and that clinical care only influences 10% of a person's health. Health is largely determined by social and economic factors, the physical environment, and health behaviors. And just to note, our department tries to address a number of the social determinants of health, such as healthy childhood development, life skills, culture, support networks, a healthy home, and a healthy physical environment in conjunction with some medical services. And we'd like to do much more. I talked a bit about adverse childhood experience, or ACEs. And ACEs are a significant contributor to toxic stress, which negatively impacts social, emotional, and cognitive development, and not so surprisingly, leads to chronic disease and early death. You can see from this chart that outcomes associated with ACEs span a person's lifetime. And it's important to note what happens in early childhood. You have impaired development and lack of educational success, and that just builds over a person's lifetime. At this point, I'd like to introduce Brittany Roy, who is going to talk about briefly about her experiences and her involvement in Healthy Start. After that, Angela is going to talk a bit about our programming, and then I'll come back up to close the presentation.
Good afternoon, council members. My name is Brittany Roy, and I'm a program participant with the Twin Cities Healthy Start program. My significant other and I, we've been a part of this program since I was about 5 months pregnant. And my caseworker is Valencia, and she's been working with us since I was 5 months pregnant. My daughter is now 11 months, gonna be 1 year old next month. And coming from experience and being a part of this program, I feel that a year ago, or about a year and a half ago, looking back at our life where we was then and how we are now, we had came a long way of being a part of this program, because we was living with I was living with my brother, with my significant other, and after meeting with Valencia, she, she would do home visits, not necessarily in our home, but she would meet us in a comfortable place, because it was hard for us to move around to get places. And with her coming to us, it made me feel more comfortable with her. I feel like that, I don't know how to explain it. With having her come to us, it felt like almost, I'm so stuck with words right now. I don't know how to explain it. It's when she comes to us, it makes us feel like important, like we're a part of this program, and we don't feel like we're just, just a case to her. We feel more like we're family, and she helped us the program has helped us get into a stable environment. They helped us get into our first home, get everything ready for our daughter when I was pregnant, having all the support groups, going to them, having them, you know, rooting for us the whole time with my pregnancy and helping us with our, you know, getting ready for our daughter. I believe that with her coming to the house has like changed my life, and I don't look at her as my caseworker no more. I look at her like more of my friend and someone that I can talk to, and you know, when things are going hard with my daughter, like what do I do? They have a lot of good resources that we needed throughout our life, even now. And with the help we had, went back to school. I'm currently in school. You know, we're looking for jobs. I'm working. What else is there? There's a lot of positive things that are more in our life ever since we got into this program. And I'm very grateful and blessed to have them be a part of our life and being a part of our daughter's, you know, life growing up. So with that.
Could I just ask when the first visit was? How,
The first visit?
Yeah, and also how you found out and got into the program. What was that entryway?
The entry, when I first got a part of the program, I was going through the Division of Indian Works located at South Minneapolis. And the person I was working with, she had told me about, you know, the Twin Cities Healthy Start program. And at first I was kind of iffy because I didn't know, you know, much about it. I never heard about it before. With this pregnancy, I wanted all the help that I can get, so I was more open to it. And she came to us at the Division of Indian Works over South Minneapolis. And from then, it's like, I was still kind of iffy, but once I met her, it was a connection. So that was the first meeting that we had, and ever since then we've been meeting. From when I was 5 months pregnant, we've been meeting every week.
And do you know how long you get to stay in the program?
Up until my daughter's 2 years old.
2 years old.
Mm-hmm.
Okay. Thank you so much, and thanks for coming in and sharing your story with us. It's very important for us to hear this.
Good afternoon, Council.
Welcome.
Thank you, Brittany. My name is Angela Watts. I'm going to move forward with this part of the presentation. A healthy start to life and learning. We believe that a healthy start to life and learning begins with thriving babies. Through Healthy Start in our MCH programs, we reduce infant mortality by working with state and community partners to establish a state review process that helps us understand the complex factors that contribute to poor birth outcomes. We ensure that pregnant women who are at risk for poor birth outcomes receive comprehensive services through our home visiting program that Brittany described. Every pregnant woman in our program receives a comprehensive screening and assessment, access to prenatal quality services, health education, and social support to be able to ensure a positive birth outcome. We work with the Minnesota Visiting Nurse Agency, the Family Partnership, Centro, and the Division of Indian Works to accomplish this goal. Through Healthy Start and our other home visiting programs, we have provided over 9,984 home visits to 3,547 families.
How does a family qualify? Is there an income requirement?
For Healthy Start, all of our MCH programs have different factors for eligibility. Through Healthy Start, it really is about the geographical area a woman lives in, as well as her risk factors for poor birth outcomes. So our program is very targeted for those women who are particularly at risk because of the geographical area they live in or their life circumstances.
And in terms of geographical area, we're just assuming central Minneapolis, South Minneapolis, and North Minneapolis?
Those targeted neighborhoods where we know there are high rates of infant mortality. Some of our other programs have other eligibility criteria.
Thank you.
In terms of early childhood intervention, we have a program that's fairly new that we're really excited about. It's called Screen at 3. We want to ensure that children are screened by age 3. This particular project, Close the Loop, works to improve referrals and follow-up processes between the Minneapolis public schools, medical clinics, and health systems. The purpose is to improve data sharing across sectors, to improve school readiness for all Minneapolis children, and to provide increased access to services for those children who may possibly have learning challenges or learning issues. The Minneapolis Public Schools Early Intervention provided over 4,255 children that were screened. Of those, 1,304 were 3 years old. That is a 4.1% increase from 2012. 1,115 children were from birth to 2 years old, and those referrals were up as well, with an increase of 10.1. Our early intervention referral process provides services and information to 135 daycares, preschools, libraries, and medical clinics. In Region 11, the Interagency Early Intervention Committee works to develop and ensure the implementation of interagency policies and procedures with the goal of being able to make sure that we're consistent in our region, to make sure that eligible children ages birth to 5 years of age and their families are identified and have access to appropriate services and supports for their children. Through our Minnesota Child Health Screening, we've been able to do very targeted screening from birth to 10 years old, and in 2013, over 2,916 children were screened. Of those children, 869 required one or more referrals for further evaluation. Now keep in mind, these numbers from MVNA do not replace any of the earlier childhood screening numbers that I talked to you about. School readiness. We partner with the Minneapolis Public Schools, the Northside Achievement Zone, and Way to Grow. We specifically provide funding for outreach with Way to Grow and the Minneapolis Public Schools, with the whole goal of being able to ensure school readiness for our families. We have a very specific emphasis in the Phillips neighborhood, Powderhorn, and Near North communities. We work very diligently to make sure that the early childhood scholarships, that families are able to connect and access those scholarships to get their children school ready. Through the ImmuLink program, we provide immunizations for children. And through our children's dental program, we were able to provide 929 services to uninsured children. This is a 41% increase, and these children primarily reside in the Phillips, Camden, and Powderhorn neighborhood. Through our WIC program, we provide nutrition education and supplements to over 3,000 families each year. Teen pregnancy prevention and teen parent support. Through our programs that target teens, we've been able to look at our TANF home visiting program, which really is a home visiting program that's pretty much targeted for women under the age of 21. Through our MFIP Innovations program, we provide services and supports to pregnant and parenting teens who choose the educational track. Our goal is to make sure that they're successful in choosing and following their educational journey. That would help. In our school-based clinic services, we provide clinic services, health education, and reproductive health. I believe that our school-based staff will come before this committee and provide you more information in detail. I just wanted to give you a quick highlight. Through some of our other MCH agency contracts, we work with Centro, the Division of Indian Works, Neighborhood Health Services, to be able to provide sex education and support to the Minneapolis Public Schools middle school program. So at this point, I'm going to turn the presentation back over to Patty Bowler, and she's going to take you to a new vision for early childhood.
New vision. Thank you, Angela. I think that was a good overview of our work, and we wanted to let you know that we're working on a new strategic plan for all of our maternal and child health, our family and early childhood work, that hopefully is going to tie this work together and also take it to the next level. So you can see the components of our vision, but basically you can boil it down to making sure that all families in Minneapolis have their basic social, health, and environmental needs met, and that new families' constructs are accepted and health disparities are a thing of the past. Our strategic plan emphasizes these challenges or goals. The first one is to improve the early childhood system. Next, we would like to help families attain living wage jobs, since we know that income is a big predictor of health. We thirdly expand the system of care to promote mental health and well-being. Next, ensure that children are ready to learn, especially by improving child health, since kids really can't learn unless they're healthy. Focus on basic needs like housing, and also improve transportation so families can get to where they need to be. And what I tried to do on this slide is I bolded 3 of the 6 goals to indicate the goals that are work that's largely outside of our sphere of influence. In order to accomplish these goals, we need partnerships across sectors and disciplines and cultures, a willingness to learn, to take on new ideas, listen to new ideas, and to take prudence to take on challenges as they arise. The good news is that we already have some of these partners in place. You can see a list of some of our key partners here. However, we're going to need to cultivate some new relationships to work on issues like housing and employment, things that are typically outside of our sphere of influence. Community engagement is one of the keys to our success. And we also think that empowerment is also very important. And so here's a photo of Healthy Start participants at the recent March of Dimes Day at the Capitol. And Angela worked closely with families to get them there and to help prep them on issues. So we've outlined 5 areas for council leadership, and I want to really kind of close with this slide. As Councilmember Gordon mentioned, the mayor has the Cradle to K cabinet, and we hope that the council will support the recommendations that come out of this newly convened group. And I think they just had their first meeting maybe 2 weeks ago, so it's a group that's just getting going.
Could you maybe just tell us if there's somebody from the health department on that group, or a little bit of the makeup of the
Yes.
group? I don't think we've been actually briefed on.
Gretchen, yes, thank you. Gretchen Musicant serves on the group. And do you want to talk, Gretchen, do you remember who's on the group? Or some of the... Carolyn Smallwood is a co-chair along with Peggy Flanagan. So Carolyn's with Way to Grow, Peggy's with
Children's Defense Fund.
Children's Defense Fund. Gretchen, there's, I'm sure, somebody from the school district.
Well, and that's not necessarily your responsibility to clue us into it all either. But I'm mostly curious about how does the council actually have a connection there, and where the recommendation's going to be coming through. And it sounds like we're hoping they'll be coming through the health department or the mayor's office. And will they be coming to this committee?
Mr. Chair, members of the committee, the Youth Coordinating Board is also Ann DeGroot is on the group and is offering some of her staff as staff support. So that could be one formalized way that connects with you and others that are on the Youth Coordinating Board. But I think that is an excellent question, and maybe one that you'd like to offer up to the mayor, maybe have a formalized liaison of some sort so that you can be ready to respond with policy issues that come out, but I'd be happy to also be a conduit.
Okay, thank you.
Okay, thanks, Gretchen. It's really important that the council supports public health policies that affect families. So, for instance, the infant mortality review process that Angela talked about, you all voted to include that provision in the city's legislative agenda. So when those policies come forward, we really appreciate your support. Also support policies that regard jobs, housing, and transportation. And these, as I mentioned, are often policies or areas outside of our sphere of influence. And we particularly need your leadership, your connections, with other departments, with other partners to move these issues forward. Okay, resources is another key one. Most of this work is heavily grant funded, and the grant funding ebbs and flows. In fact, we were hoping to have heard about our Healthy Start proposal. We've got a big competitive grant into the federal government. They were supposed to let us know on June 1st whether this work could continue. They're now going to let us know on September 2nd. But the grant, all of our funding just kind of ebbs and flows. And so your leadership to help us continue to invest in this work is really important when grant funding is lacking.
Member Kano, do you have a question about the grant?
Thank you, Mr. Chair. I do have two questions, and I wasn't sure where exactly to insert them,
Okay.
so I'll just ask them now.
Okay.
So do these programs work with women in connecting them with either midwives at a low or reduced cost or at a free cost? And then what's the relationship of this program to nutrition opportunities and promotion of breastfeeding?
I probably can't answer the first one. I'm going to have either Angela or Stephanie talk about that. But nutrition is a key component that gets stressed throughout the home visits and through other programs. And I'm guessing breastfeeding is a very important best practice that gets talked about. But do you want to answer the midwife one, Stephanie?
Welcome.
Hello, I'm Stephanie Graves. And to answer the question, excuse me, on the midwives, we used to be able to connect to doulas and midwives easier, but with the decrease in funding, that hasn't been so easy. What we do is we connect them to clinics that have access to midwives, and so through they're able to connect with either MNsure or some type of insurance, they're able then to get connected to a midwife. But the doula system is a little bit tougher because there's no current funding to get reimbursed for that. So if we can get projects funded where they can pay for that service, then we could do a lot more of that. And regarding the breastfeeding, we work with clinics and agencies that do promote breastfeeding, and we also have our Public Health Advisory Committee that is focusing on trying to encourage more breastfeeding through the hospitals, specifically Hennepin County and North Memorial, and work with our women. Thank you.
Yeah, thank you. I'm a big supporter of home births and midwives, so I just wanted to ask that question because when I heard your speech, what I hear when you talk, it's about empowerment, and so a woman's ability to take control of her own birthing experience is really about empowerment and leadership development. So on that note, is there a way to connect some of this work to advocacy, or some of the folks that are participating in the programs, do they organize to change policies? Do they organize to advocate for more funding for specific issues or initiatives? When we talk about nutrition, for example, I represent Little Earth, I represent East Phillips, Midtown Phillips, so a lot of times nutrition is connected to the food available in our neighborhoods, and sometimes we just don't have healthy food available, and sometimes when it is available, it's more expensive. And so is there a connection between some of the advocacy work and some of the programming that you have outlined?
So I know that Healthy Start has a pretty good coalition in place, and if this new grant gets refunded, it's going to be even strengthened to do more of that advocacy and empowerment. And I just have to say, I think the department is trying to connect the dots more. So I also oversee all the healthy living work, and I'm really happy to mostly happy to be overseeing all of the maternal and child health work because there's such a strong connection between the two big bodies of work. So hopefully we can bring those elements more together. Do you want to say anything that I haven't said? Yeah, sure. Betsy?
Hi,
Hi,
my
welcome.
name is Betsy Bartek, and I am from Twin Cities Healthy Start. I'm the supervisor at the Family Partnership. I've been kind of put on the spot here. So what I did want to talk about was our advisory board. At one point, someone asked about, do the participants advocate for breastfeeding or for anything that they feel is important? And yes, once a month we meet. and it's called Twin Cities Healthy Start Advisory Board, and all the participants are invited. We transport them in, we feed them, and we also have child care for their children. That is when things are like when we did a new brochure, those things were placed in front of them. What should we add? Where should we put these brochures? Also, we had a grant through the March of Dimes, and we did a big, and that was a nutrition group. It was called Healthy Decisions. And so what we try to do is we have this group of women, and then those women go out and they tell other women and other women. So that's how we do our advocating.
Thank you.
Excellent.
Thank you.
Just so the men don't find out.
Oh, yeah. Oh. They're very important, and we have a new initiative on fathers. Just very lastly, the other piece is to look at all, policies with us and procedures and programs with that health equity lens, because that's part of the grounding of our family and early childhood work. And here's contact information. We thank you for listening to this presentation and would love to hear your comments if you have any additional ones or questions. Thanks.
All right, thank you very much. Councilmember Fry has a comment or question.
Thank you, Chair Gordon. I have two, hopefully, very brief questions. First of all, extraordinary work. It's really exciting to see, us tackling an issue right at the very root, and you're most certainly doing that. The first question that I had was in regard to sex education, condom use, and how our city is partnering with either schools or the health department or anyone else. I know you've had extraordinary results over the last several years. I would just like to hear about how those results have been achieved.
I'm going to introduce Coral Garner, who's another director in the health department who oversees that work.
Welcome.
Good afternoon, council members.
Good afternoon.
Repeat your question.
So I'm aware of some extraordinary results that we've seen in the last 5 or so years in reduction specifically of teen pregnancy. First of all, well done. Congratulations. You're obviously doing something right. I just want to know what that right thing is.
Well, it's a combination of things. I think the work that's led out of the health department specifically is through our school-based clinics. We provide sex education and reproductive health services through our school-based clinics, which are located in 7 high schools locations, the Minneapolis Public High Schools. And then I think this is probably the 4th year that we've partnered with Minneapolis Public Schools to provide technical assistance and to subsidize training for their health educators in their middle schools. One of the things that we discovered, it was probably in 2006, 2007, was that with some of the changes in the health requirements, that health education was not a required course in middle schools. And so we partnered with Minneapolis Public Schools to work with the principals and their health educators to really provide technical assistance and recommend that they use a science-based approach to sex education. And so this is the 3rd year that that program has been in place, and I actually just got a report for this past school year, and I'm happy to say that there is programming in all of the middle school locations in Minneapolis Public Schools.
And so the funding for these school-based clinics, it comes through the city then?
Yes.
Okay. That's wonderful. And then and what's the dollar? Do you have any idea of the dollar figure that we're spending on these clinics?
I can't answer that right offhand, but it's a combination of funding that we get from the state, as well as because we're providing medical services, we also bill the students that receive services for being seen in our clinics, and so we receive some reimbursement for those services as well. So it's a combination.
I'd be really interested to see what the dollar figure that the city is putting in, so I can better make the argument that we are getting a tremendous bang for our buck.
I'm sure that could be provided to you.
Oh, yeah, we can send you that information.
That would be wonderful. Thank you so much. And I'll hold my second question. I don't want to.
Are you sure?
Yeah, I'll.
Because
I
you
can.
teased us all with 2 questions.
Okay, I'll give you the second question too. I've I'll be very brief. The second one relates to the work that you're doing with fathers. I've done a lot of work, not just in Minneapolis, but really throughout the country with sort of underprivileged communities. And just to say it bluntly, one of the things that I've seen the most of is you see it really goes across every single city or community is very, very, very strong women and oftentimes very weak men. And obviously that's not universally the case. I'm stereotyping, but what are some of the tactics that we've done to bring the fathers back into the fold?
Thank you for the question, and Councilmember Fry. There's a couple things that I'm aware of. I don't oversee that part of our programming. Pat Harrison and her team recently wrote the grant, this new fatherhood grant, and they can give you a better explanation. But I know we've done a series of focus groups to really look at father involvement with men and to try to figure out what are the factors that are influencing their involvement or lack of involvement in their family's life or with their child. And those are very multicultural groups, or they have been. What we're trying to do, too, is pair the Fathers Project, which is a nonprofit, with the Minnesota Visiting Nurse Agency, and to make sure that there's a connection for fathers. So oftentimes we're going into the home to provide services that are focused on the mom and the baby and kind of leaving the father out. So we're trying to also provide services through the Fathers Project to fathers, and that's a relatively new partnership. And with the grant, they'll be doing some of that work as well. I know it's a research grant, and I'm hoping that at some point when the grant gets underway that we can come back and give a future presentation about that work. What do you think, Gretchen? So, just because I'm not totally versed on all the elements of that project.
Thank you.
Yeah, we'll make sure we hear more about that.
Yes.
Too, as it,
do you want to talk
in.
to an actual father?
I'm sure he's among the strong fathers.
We can, you don't have to be put on the spot right now if you don't want to.
We just want to make sure everybody in the audience gets a chance to talk today. So,
How about we'll have a conversation right afterwards.
Okay.
Look forward to it.
Great. All right. Thank you very much. I think that's it for our comments and conversation. But thanks so much for this presentation, and we really look forward to this. And we're going to continue to grapple with how are we connected and involved in the Cradle to K. And we're going to count on you, Ms. Musican, to help us keep pace, and we'll look forward to some recommendations that come forward. I will move to receive and file that presentation and report then. Seeing no comments, then all those in favor say aye. Aye. All those opposed? And now we have one item remaining, and this is the recommendation that we asked for from our Minneapolis Tree Advisory Commission regarding how the city should spend or invest their city property reforestation funds of $450,000. And making this report is the council's representative on the Tree Advisory Commission, the Robin Garwood. Lee. Welcome.
Thank you, Mr. Chair. As you said, I'm Robin Garwood. I am the City Council's rep to the Minneapolis Tree Advisory Commission. On April 28th, this committee directed the Tree Advisory Commission to come back with recommendations about how to spend the capital dollars that were set aside in 2011, 2012, and 2013, $150,000 each of those years for a total of $450,000. Only a little bit less than $7,000 has been spent to date. And so I'm here with the recommendation from the Tree Advisory Commission on what to do with those capital dollars. The recommendation is to abandon the city property reforestation appropriations and create a new project, actually two new projects. The first would be $393,000 for the removal of tree coffin structures and other paved public areas in the downtown area and in other public built-up areas and commercial corridors in Minneapolis, replacing the underlying soil infrastructure and paving surfaces with currently accepted better urban tree environments with a minimum of 500 cubic feet of planting medium available per tree to support healthy mature trees, and reforesting the areas with new trees. And I have an example of what a tree coffin looks like on this projector thing. So this is what the Tree Advisory Commission is talking about. This is not an environment that is conducive to having a healthy, mature street tree in the long term. What ends up happening is this. And if you've been to Cedar Avenue on the West Bank or many other places in town, you've seen these kinds of structures that were built back before we had some much better ideas about how to plant trees in difficult environments like on streets that we currently have today. This is not a place where you're ever going to have a healthy, mature street tree. We now know a lot more about how to install healthy, mature trees. There's this Swedish soil, which is basically just crushed rock. There are ways that are currently being thought about for Nicollet Avenue, where we would actually do some resin-bonded aggregate on top of that lets air and water get down into the structural soil underneath, but also provides a good place for people to walk. And so the idea is, let's spend this $393,000 on creating better holes to plant trees in. And I do want to just point out that this minimum of 500 cubic feet of planting medium per tree, that's if you've got two or more trees in a row, they don't necessarily each have to have 500 cubic feet. They can kind of share that. So it's not necessarily 500 per tree. It's that each tree has to have access to 500. So that's the first recommendation. And the idea is that Minneapolis Public Works would actually do the work to change the street environments here, and the park board would be, as they always are, responsible for planting and watering the new trees. The second recommendation is to allocate $50,000 to the Minneapolis Park and Recreation Board for the planting of fruit and nut tree groves in public parks. And that is in keeping with the currently still draft Park Board Urban Agriculture Plan, which calls for the Park Board to designate park spaces for edible landscapes, grow food-producing trees, shrubs, and perennials suitable for human consumption. They actually have some budgetary numbers on that add up to $35,000 over the course of 5 years. So this would really jumpstart that work. And they're going to have to figure out how to do a maintenance plan for those, because those trees are probably not going to be maintained by forestry. They're probably going to be maintained by the community. And so they have to figure out how to do this, but these dollars can sort of help start that conversation. So those are the recommendations of the Tree Advisory Commission, and I would stand for questions.
Councilmember Frye.
Thank you, Chair Gordon. Thank you, Mr. Garwood. So this is $450,000 that's coming out of a CLIC line item in the budget. Is that
3 CLIC line items?
3 CLIC line items. I'm sorry, 3 CLIC line items from the budget, totaling $450,000.
Yes.
What I anticipated when we initially took this line item away and sort of gave it to staff to come up with recommendations was that at least a chunk of this would be left for handling emerald ash borer and taking down the trees and then replanting as quickly as possible, as well as grinding up the stumps. What I've been a bit confused about, and Mr. and Robin, I know we talked about this before the committee meeting, is that what's happening is a lot of these trees are being lopped down, the stumps are being ground up, and then a new tree is not being planted for sometimes as much as 8 or 9 months. And clearly that's 8 or 9 months that these neighborhoods are going without that portion of the canopy. And some of these neighborhoods, by the way, they're losing about 85% of their total canopy. So I guess my question is there a way of is there a way of allocating some of this money to expedite the process in replanting so that these neighborhoods they get a large tree in its place as soon as possible? That's the first, and then I got a couple more.
Okay. Chair Gordon, Councilmember Fry, that was one of the eligible uses of capital dollars that the Tree Advisory Commission discussed at the meeting in which we came up with this recommendation. We actually discussed quite a few different ideas. Many of those were not eligible uses for capital dollars. So, for instance, watering trees, that's something that we couldn't do. Enhancing or doing a new version of our tree canopy study, that's something we couldn't do with capital dollars. The response that we got from forestry at the park board was that this amount of money, even if it was all of the $450,000, was not something that they could necessarily incorporate easily into their EAB response. Essentially, what they said was, we don't need additional capital, we need additional operating dollars. Our problem isn't that we don't have enough money to spend on new trees, it's that we don't have enough ongoing staff capacity to get those trees planted quickly enough for that additional capital to really help in any way. So they strongly encouraged the commission not to just put the money towards EAB and to instead try to address these kinds of environments where it's hard to grow a healthy, mature tree canopy, like on Hennepin Avenue or like on 4th Street in downtown, which was one of the sort of first pilot areas that was being discussed. So that's how we came up with that recommendation. I mean, the park board forestry essentially said, we don't want that money for that purpose.
So after we spoke, Mr. Garwood, I got in contact with Liz Walensky, who subsequently had a meeting with Jane Miller over at the park board. And one of the more expensive items in replanting is the grinding of these stumps. Mm-hmm. And she mentioned that some additional monies for the grinding of these stumps would help make their process more efficient so that they could then get trees up faster. Do you see a way of allowing some of that $393,000 and or the $50,000 for the fruit and nut trees to be? I want to give them the option. If the park board would be better able to get the trees up via X, then maybe we could use the money for that.
Through the chair, Councilmember Fry, I actually think that that's part of the conversation with the park board is can they spend that money? The other part of the conversation is with our own finance folks to see if stump grinding is an eligible use for this kind of bonding capital dollar. So I would say probably that's a conversation to have with Mike Ablin. Given the conversations that we have had about these dollars to date, I'm going to just hazard a guess that it might not be an eligible use for capital dollars because we really want to be able to point to the capital improvement that has happened, and the stump grinding is you can't really point to the ground stump. So that's a question for Mike. We can definitely talk to him after this committee meeting and see if that's something that we could do with these capital dollars.
So one alternative would be to move it forward with recommendation and just see if and have some of those discussions before the council meeting. But also, did you have more questions?
Thank you, Chair Gordon. Yeah, that would be fine moving it forward, and then we can subsequently have the discussions and if amendment prior to the council meeting, if we have one, then I can certainly make it then. You know what, I really don't have any further questions. I think I really need to do my research a little bit more outside of the committee meeting.
Okay. Well, I appreciate that, and I appreciate the report. And I will say that I was expecting more of the park board will take some more money so we can help them buy more trees and plant more trees. But apparently they also have a great deal of funds already because of the levy, and so it was an unexpected and interesting advice that we got back from the Tree Advisory committee. And I don't disagree that there isn't a problem with these tree coffins, as they're called, and it's could really yield some great results if we can get more trees on these certain streets that it's been so difficult with. But so thank you very much, and I think I'm going to then just move this forward without recommendation in case we are able to reach some agreement and after we have more discussions with finance, particularly, I guess, on the tree stump grinding idea. On that motion, is there any comments? Councilmember Glidden.
Sure, and I guess I can support that. I just, it almost seems like it would be better to forward this with the recommendation than amend it potentially. I just want to say when we forward it without recommendation, sometimes it gets a little confusion at the full council meeting, but you'll march that forward.
Yeah, I think we could probably march it forward either way. I think when saying it's not with recommendation means we really want to get this little bit of work cleared out of the way, and it's more of a reaching out to Councilmember Fry with his concerns than otherwise. So, but you're right, we could deal with it either way, but I'm going to put that out there, I guess, is the option for this. Figuring when we report into the committee, we can do so with a kind of a consensus opinion, or at least I can move something that I'm comfortable with then and see from there. Okay. No further comments then? All right. All in favor, say aye.
Aye.
Any opposed? All right. That motion carries. Seeing no further business before us, then this meeting is adjourned. Thank you very much, everybody.